Content warning. The subject matter within this episode may be inappropriate for those under the age of 18. Please listen with discretion. This episode discusses EMDR, a technique to be used under the care of a trained mental health professional. Within the episode, there is mention of suicidal ideation, dissociative identity disorder, psychosis, and other mental health related topics. If you feel any of these subjects may be triggering for you, please skip this episode. If you or a loved one is struggling or needs someone to talk to, there is help. Call or text 988 in the USA for the crisis hotline, or connect to those who can help by calling your local emergency or non-emergency number. I'm your host, Ariel Willow. Welcome to Ghost Tea Podcast, a podcast for those who seek magic. Hello, everyone. Welcome back to Ghost Tea Podcast. This is the first episode of season 5 of Ghost Tea. It's crazy that we have come that far. As you all know, we have Chris here who has been on a previous episode of ours about psychosis, and we have her back again today to talk about EMDR, and we'll get into that. But before we get started, I just want to go over the disclaimer that I always like to put out there. This is my own personal opinions and the opinions of those on the show, and I just don't want you to go into this trying to replace any kind of information or advice in this session with anything of a medical professional or anything like that. So just make sure that you keep that in mind, but also just don't feel like we're trying to push beliefs or anything on you. These are just our personal opinions, our personal practices, things like that, our personal beliefs. So with that said, let's go ahead and get started. Chris, can you tell us a
Hi.
little bit about yourself, since
Yeah,
this may be people's first experience with you on the show?
sure. Yeah. So my name is Chris Lombardo. My pronouns are she, they. I'm a licensed professional clinical counselor in New Mexico and Oregon. And I'm also a certified alcohol and drug counselor in Oregon only. I'm trained in EMDR. I absolutely love it. I've gone from feeling like it's easy to get stuck with folks to, I mean, people describe it as getting one EMDR session is 10 talk therapy sessions. And that's feedback from
Wow.
clients. And I'll say, as a client of EMDR as well, it just moves so much quicker than just talk therapy. So I've seen tremendous results and I always get really excited to talk about it. Like I said, I'm trained in EMDR and I'm working on becoming certified. I actually only have one more consultation to do before I'm a certified EMDR therapist. And I'm really
That's so
excited about
cool.
that. So I'm really heading down the path of trying to do only EMDR as opposed to just kind of like ongoing talk therapy, because I have seen a huge difference in people's lives. And it integrates perfectly with like spirituality. And really, you can come just as you are, and EMDR is going to be helpful. And I'll explain more about that in a bit, because I know some people have had really horrible experiences with EMDR, and I totally understand that. I live in New Mexico with my partner and our cats and our plants. My partner's also a therapist, and they do more CBT and internal family systems work. Yeah, that's me.
Awesome. And if you want more information about Chris, I will also have their information in the description below or the comments below. So check that out if you want to find their website and things like that. So I guess the first thing that I want to go over is, what is EMDR? Like what is it used for? Who is it primarily like targeted for, if that makes
Sure.
sense?
Yeah, so EMDR stands for eye movement desensitization and reprocessing. That term came from the founder, Francine Shapiro, in the late 1980s. So it's a little outdated because you don't actually have to use just eye movements anymore. I mostly use buzzers, one in each hand for people, where it creates a bilateral stimulation, meaning you'll feel a buzz in the left hand and then the right and then the left, and so on. You can also do audio now, so it's like a little bell in each of the ear with headphones. Or you could do tapping on the shoulders, on the knees. We're just looking to like activate the two different sides of the brains repeatedly back and forth. So eye movement desensitization reprocessing, you'll hear that term as like the overhead term, but there's lots of different ways to do it.
Is that similar to tapping?
It's similar to tapping. Yeah, a lot of people learn tapping from like emotional focused
Mhm.
therapy. Um, but I think that the difference is with the typical tapping that's hitting onto the meridians of the body, which also links into
Okay.
like the chakras and a lot of spiritual belief systems. Um, but we're looking for bilateral stimulation. So it's like repeated back and
Mm.
forth instead of just tapping on the meridians. Both are great, but we have to activate the bilateral side for EMDR to be effective.
Okay. And as far as EMDR therapy, because I know that you said that for a lot of people, like it almost makes it like a fast track towards a healing experience for people in comparison to talk therapy. So, in terms of what you've seen with clients and what you've learned through your own training, like who do you feel like would be a good fit for EMDR?
EMDR is mostly targeted for people with PTSD, but it works for a lot of different things. The idea is that when we experience a traumatic moment in our life, it's almost like our brains get frozen in place. So it kind of like plays the videotape of that trauma over and over again as if you're still there. So, what EMDR does is it targets that and then it uses the brain's natural way of healing. So, when we sleep, we go into rapid eye movement sleep and our eyes move rapidly back and forth. And so the theory is that we're tapping into that same part of the brain, but it's targeted. So when we go to
Mm.
sleep, our brains are doing the thing already, right? It's trimming away what we don't need. We don't need to remember the guy who walked in front of us on the sidewalk yesterday. If we remembered all those small details of life, we would go crazy. So it like trims that away. We don't need that. And it strengthens the things that we might need. So people might get a really big stress dream before a work presentation or something. The reason we do that is because the brain's like, oh, I got to remember I have this big work presentation. I got stress and practice and like think about all these different things that could go wrong so that it solidifies in the brain. The problem with trauma is that the brain can't differentiate. It sees it as like, oh, I need to remember this. This was dangerous. This
Mm.
was a threat to my survival. So I'm just going to have nightmares about it over and over again, never let it go.
So
So
helpful.
I know it's great, the audacity of our brains. So instead, it targets into the memory, whatever that might be, and we use the bilateral stimulation where you're both conscious and sinking into this kind of meditative state where you're able to just kind of like hold dual awareness of like, okay, you're right
Mm.
here in my office, you're right there in your room, and we're thinking about this thing doing bilateral movements. So it's mainly for people with PTSD and trauma. I'm a big believer that most people carry some kind of trauma. You don't have to have a PTSD diagnosis to have trauma.
Right.
Trauma is the basis for a lot of other diagnoses like depression, anxiety, grief, substance abuse disorders. So it can be used to treat all of those different things. I love using it for anxieties and phobias. I think that those are great ways to use it. There are some people where EMDR can be tough and there needs to be a ton of preparation. So I think that when people have the experience where they felt like it just re-traumatized them, that is clinician error where the clinician
Mm.
didn't do enough resourcing, baseline work, or assessing for dissociative disorders in order to begin that phase of EMDR. Because there's a lot of different phases that lead to the actual bilateral, but there needs to be a huge baseline of safety first in order to do it properly.
Okay. So if someone experienced or deals with a lot of dissociation, is that something that would be possibly a negative thing going into EMDR, or is that still something that they could do, but just with what, like what you said, that prep
Yeah,
work?
they can absolutely do it. Anybody can do it. However, you need a clinician who specifically is trained for dissociative disorders and
Okay.
EMDR. It can go very wrong. It taps into these deep places. We're staring right at huge traumas that are incredibly painful. So there needs to be a baseline of being able to develop a window of tolerance to look at and be with those memories without it just like flinging you into the atmosphere and suddenly you're like gone,
Right.
right? So when I do EMDR and I'm preparing with somebody to do it and they have dissociative stuff going on, we take probably like a year and a half to do preparation. There has
Okay.
to be a good relationship built between me and the client. And we would do a lot of stuff like resourcing, which is kind of the precursor to doing the trauma related stuff. I think when people talk about EMDR, they're often thinking about like, oh, we think of this trauma and then we do eye movements and that's EMDR.
Right.
But there's something called RDI, which is a lot of the preparing stuff. So, for example, you might think of a white light of protection surrounding your body, and we want to sink into the feelings of like love and support. You can bring in spirit guides. If you have a friend that's like a really good mom and you just admire them, you could imagine that they're your inner child's mom, right? And then we do some bilateral, but it's very short sets, 8 to 10 sets. And they're very slow and calming rather than in reprocessing, we're doing them very, very fast and they're like 30 movements each time.
Okay.
So it's a lot slower. It's a lot more focused on building the window of tolerance and resourcing yourself to be able to look at the trauma.
That's so interesting because now I see like where that parallel with kind of some more spiritual leaning like approaches to,
Totally.
what people talk about like shadow work and stuff like that is seen
Absolutely.
with EMDR, which that was the next thing that I was going to ask because when I was talking with you the other day about EMDR, I went into the the Reddit world
Uh huh.
and went into the Reddit forums and just was reading about people's different experiences with EMDR, both more mundane, just kind of walking through their traumas and things like that. There was someone who was talking about seeing like the white light and, their guides. Some people were talking about how in regular everyday life, like they're Mormon or they're, more agnostic. And then in their EMDR experiences, they're talking with their spirit team and the
Hmm.
past loved ones and these elf-like creatures and things
Hmm.
like that. And then another person was talking about like talking to Jesus and stuff. So I thought it was really, really interesting to see people talking about the different experiences they had and how they honestly tend to seem more spiritual in experience than more, mundane therapy stuff.
Right.
But then there was also other people who were saying that the EMDR therapy experiences felt very similar to their experiences with ayahuasca ceremonies and things
Yeah.
like that.
Mhm.
And that was something that you mentioned as well before we actually started recording, was that it can feel almost like a trip.
Totally. Yeah, it absolutely can feel like a drug trip. And the thing is, everybody's experience is so different. Had clients who think very much in narrative symbols and storytelling. So every time we
Hmm.
stop, it's like a continuation of a story. I have people, including myself, I tend to kind of dart all over the place. So I'm like thinking about this and suddenly I'm over here.
Yeah.
But it doesn't really matter what people's beliefs are because it can be woven in so wonderful. I've worked with Christians that it's so easy to like imagine Jesus right next to you, supporting
Yeah.
you, feel that warmth, do a set there. What do you feel? I feel relaxed and calm, right? I feel supported. Okay, focus on that. We'll do another set. So, anywhere from that to people who are like staunchly atheists, theirs is like, I'm noticing like a wiser version of myself. So, it's more like
Oh,
parts work.
interesting.
So, this wise part of me is coming up. They're like 90 years old and they've lived a life and gathered all this wisdom. So, the thing is, like, it's a very spiritual experience for most people. And even if people don't use the language of spirituality, it's very much the same exact thing. It's just the different
Yeah.
language of understanding of like my inner child, my wisest part versus an outside guide. And both are great, both work.
Right, right. And it's almost like the higher self kind of coming through if you look at it through
Yeah,
like more of a spiritual lens rather than a more mundane thing, which is
right.
so interesting because like that happens a lot in my shadow work sessions where I'll come across, my higher self, we'll have a conversation. I'm just like, you're so wise and knowing. Like I wish
Yes.
my everyday life could be as wise and knowing as you.
Yeah. Yeah, they do come up. And what's cool is sometimes I'll combine EMDR with internal family systems, which is that type of therapy that uses language of like the higher self, the managers.
Mm,
I've got a lot of perfectionistic managers inside of me. There's inner children, there's exiles, which are the parts of us we don't really like want to look at, like
mm.
neediness or loneliness. We don't like those parts, but in IFS there's no bad parts. So we're trying to embrace each part. And you can use EMDR to connect to those parts, whether you use the language of the higher self or a guide or this exile that I have. We're using the bilateral while almost having like an internal family meeting where it's like, okay, so the manager part is here and they're trying to grip onto this narrative. And I see my wise self looking at them with compassion. Okay, notice that and then do bilateral and see what comes up. So, yeah, it feels so intuitive to me for some reason.
Yeah.
It's so natural. People's brains naturally go to this like parts work or from a spiritual realm, the higher self, past lives, all of that kind of stuff. People's brains naturally do it, and I just sit back and witness
That would be so fascinating because it's
it.
like almost being able to have like a peek into people's inner worlds. And that is so true. Like that's something that comes up a lot in conversation with clients and people, during live streams and stuff like that, where they're talking about dreams that they've had or things like that. And I have to sometimes remind people, like when you're sleeping, like your brain isn't trying to make anything make sense. It's just
Right.
allowing what is coming through to come through.
Hmm.
So it's more one of those things where you're able to just experience your experiences for what they are instead of trying to overanalyze them, which we
Yeah,
do when we're awake. So I feel like a lot
right.
of times we're able to have more spiritual experiences when we're sleeping because we're not trying to overanalyze it. We're not trying to make it make sense because we're just like, oh, well, I'm in a sleep space. Like it's totally
Right.
fine. It doesn't matter if it makes sense?
Which is also why sleep is like so important. When I'm talking
Yeah.
to people who are like, "Oh, I don't know why I'm so anxious and depressed." I the first thing I asked is, how's your sleeping? Are you
Hmm.
eating? Are you drinking water? And are you sleeping? Because if you're not sleeping, you will be anxious and depressed. There's no
Right.
exchange. You have to. And especially after going through a huge traumatic event, the number one thing that you need is to be able to sleep consistently so that your brain does that natural healing work that it does on its own. And if you still have symptoms after that, then you can do the therapy work. But the sleep part is the therapy for most things that happen.
Right. Oh, yeah. Because I remember after my, initial like big trauma experiences, like those were times where it's so difficult to have that consistent
Yeah.
deep sleep because your body is still working through that initial trauma on set.
Yeah.
So it's like
It's
all of,
hypervigilant.
yeah, the hypervigilance, the nightmares, the flashbacks, things like that. And that can really disrupt sleep, which then brings all of this host of other issues on that can make it so difficult. So yeah, like whenever I am noticing myself being a little bit more on edge or things like that, I'm just like, it's time to have a couple days where I'm just like taking
Right.
naps.
Yeah.
Like,
Yeah. Just sleep. Just get into that REM sleep. Even if it's like a 20-minute power nap,
mhm.
that still is going to help your brain.
In terms of more like spiritual stuff, because I feel like we've kind of gone over the more mundane uses for it. Have you had any people who have come to you and kind of gone through that initial trauma experience and maybe want to kind of use it as more of a spiritually focused thing? Have you ever had experiences like that?
Yeah, in fact, I've had people come that felt very disconnected spiritually, and then in through the EMDR process, they reconnected to this like
Okay.
higher level spiritual self. I can't get into like the details of specific
Yeah.
people, but what I can say is that people will go from being like very hidden in the weeds of the trauma and that's all they can see. And a common theme that I see is people being able to zoom out, which feels very
Mm,
spiritual, right? The ability to
right.
zoom out and be like, this was a moment in my life, the smallest moment of my life compared to all of these other memories. And that's how people really start shifting out of the trudge of the trauma into a
Hmm.
place of like, oh, this is this is just the past, right? Because when our brains are like focusing on playing that videotape, it's the videotape of the trauma, and it's trying to remember it over and over again, so that it's like, if I let go of this, I will be in danger again, which isn't true,
Right.
right? So the ability to surrender, I feel like, is a really spiritually focused thing. The ability to zoom out and see it as just a moment. It's a memory that I can let go of. And then in resourcing, of course, people tap into all kinds of things, whether it's past lives or spirit guides, or sometimes people who are really connected to nature. I'll have them imagine like connecting with a mountain or a tree or a river, whatever they pick. And it's like, okay, what does a river do when it hits a rock? It doesn't try to battle the rock or try to say you got to move rock. It just flows around the rock. And that's where people start tapping into that spiritual side of themselves to be like, oh, I can just go around the rock.
Yeah, yeah. And I think that's often something that a lot of people do in shadow work sessions too, of like, as you said, realizing that it's just like these things that we're so consumed by is actually just really a small portion of a long timeline. And sometimes
Yeah,
it's that pulling back and seeing the bigger picture that's just like, oh, it's it's there, right? It's something that I'm acknowledging and I'm aware of, but it's not the entirety of my experience. And
right.
sometimes that can make it feel so much smaller than it actually is. And not, of course, insignificant, but like it almost helps put it in perspective of like, I don't have to have it be part of my entire
Yeah.
experience, you know?
Yeah, it doesn't have to be encoded into your body now as a
Right,
mechanism for survival, right? If you went through something 5 years ago and it was horrible, you've already gotten the wisdom from that. You know, you've learned, oh, I don't want to put myself in a situation where I don't feel safe. You're already going to make those adjustments. I find a lot of people logically, they know things. So when they come into therapy,
right.
they're like, well, logically, I know that I'm wanted and that my boyfriend really loves me and cares about me. But inside, I'm terrified that something's going to happen, that he's going to cheat on me or something.
Hmm.
Maybe they had betrayal trauma. So they know that. They know that their current partner is very supportive, isn't cheating, and all of that stuff. But their body is like, I'm terrified. And that's
Right.
where the EMDR can move that old videotape, because the videotape is there to be like, is there something going on? Is there something weird? Like, I need to watch him to make sure I'm safe. But in reality, that's a narrative, a videotape that can be let go of, because this person is not that person. And also, you are not that person anymore, right? Like
Right.
you've grown, you have this wisdom. So there is a lot of reorienting this tape and splitting the logic and the body's experience. It holds the trauma, and that's where the bilateral really helps. It allows the movement to like get that trauma out of the body. We know from evidence that talk therapy actually makes trauma worse, because we're really just replaying that videotape over and over again and not putting
Right.
it anywhere. Where EMDR or things like neurofeedback, somatic experiencing therapy, anything that has to do with the body or movement will move the trauma out instead of it just staying stuck.
Because I feel like that kind of taps more into the emotional spaces too, like not
Mhm.
just the mind. Because when you're, as much as I am such a big advocate for like talk therapy, I fucking love therapy. Like,
I know.
yes, but
It's good
like,
stuff.
yeah, but like it is very mind based, right? Because
Mhm.
that's what a lot of talk therapy is. It's like working through those thoughts and recognizing them and being able to replace them with other thoughts. But when you're talking about experiences in the past or trauma and things like that, oftentimes it is that approach of like what you said of logically knowing, this isn't happening anymore, or logically knowing you're not with a previous partner, or logically
Right.
knowing you're not currently in danger, but physically or emotionally still having that reaction of like, I need to be hyper vigilant, or I need to be ready if
Mhm.
something
Mhm.
happens, kind of thing.
And sometimes
Um,
it's so subconscious, you don't even
right.
know that you're doing it, but your body is like pulling away from your partner or something, right?
Hmm.
And you're just like, I don't know, I just don't want to be anywhere near them. And you think it's happening in the current moment, but really it's just the videotape replaying again.
Hmm. Hmm. And that's, I think, something that we see come through in dreams all the time too. Having that emotional processing coming through in dreaming rather than being super present in our everyday
Totally.
cognitive experience, which is
Right.
so fascinating. As far as connecting with past loved ones, because I know a lot of people mention that, do you feel like that is something that is fairly common for people to experience with EMDR, or do you think that is something that is more so just something that might happen or is more want based rather than spiritual experience based?
Yeah, I think it totally depends. I think it depends on the person's belief system and it depends on what we're targeting. So if somebody's coming to me with the grief of, let's say, losing their mom 2 years ago, obviously mom's going to come up in EMDR, right? Because we're
Right.
targeting the loss. Let's say it's from terminal illness like cancer. So the person knows that mom's going to die and they went through that whole process. So often I look for what is the worst part of that, right? What was the worst part of mom dying? And maybe our hypothetical person said, well, it was the lead up, not the actual death. So we would actually
Hmm.
target the lead up. And what's cool is sometimes I do what's called interweaves, which is I'm kind of like inserting a question or a prompt into the bilateral. So I might say, okay, I want you to imagine that you're in a movie theater with mom. Mom's sitting right next to you. And you're both watching this movie scene of the lead up to mom's death. Okay. And then we do a set of bilateral. And I say, let it go. Take a deep breath. What are you noticing now? And the client, for example, they might say, I just see mom smiling. And it's like, okay, notice that. And then we do another set of bilateral. So it's very much client led. I might prompt the situation, like in the movie theater
Right.
witnessing. And the purpose of me doing that's actually like we're creating distance. This is a memory that's on the screen.
Right.
You're not in it. Mom's not in it. You're both in the movie theater just watching it go down. And then it starts to shift and change where it's like, oh, this is just a moment. Or sometimes I'll have people imagine a marble in their hand and the memory gets shrunken down into a marble where you're holding it. So you're in charge of the
Mm.
memory after that. So that's an example of like mom's, of course, going to come up in that. Depending on
Right.
belief system, some people really feel like mom's right here with me as I'm doing this work. And that's so beautiful. And people who don't have a belief about the afterlife, it's still a really beautiful moment of connection to their loved one, even without any spiritual belief system. They can still feel this deep warmth and connection with their past loved one in the moment. People with really extensive spirituality, doesn't really matter what, but they're able to say mom is in the room with me right now, and that can be
Right.
really beautiful. So it's very similar experience but two different ones. So that's how it can show up in like trauma reprocessing. For resourcing, I think that it's a whole different like calling in. So let's say you had a grandfather that you really loved, was really supportive of you, have always felt connected. So I
Hmm.
might say that's your loving figure. So what did grandpa look like? When you look at grandpa's face as you think of it now, what are you feeling? And people might say like I feel love, I feel connected. So we would do a set there to really integrate that feeling. If grandpa had a color emanating from him, what color would it be? Okay, notice that. Do a set of bilateral. So it comes up spontaneously in a trauma thing. It could come up in resourcing on purpose to like bring in that loved one. And I think that if you have strong spiritual belief system where you do feel that there's a connection to the other side and that your loved ones are there, if you go to an EMDR therapist, I think that it's perfectly reasonable to say, I want to use EMDR to create a resource to connect with my loved one. So that anytime
Mm.
I need mom, I can just say, mom, and then she'll be right there.
That's really cool. So almost kind of creating like a telephone line, essentially.
100%. Yeah, that's what it feels like. And for the people who aren't spiritual, that telephone line is just within themselves, right? It's this feeling of
Yeah.
like the memory of mom is my connection to mom.
I was thinking the same thing when you were talking about someone's experience who might not be as spiritual or have more of like spiritually based beliefs of the afterlife and stuff, and how kind of more of the memory of them is the presence that someone who has a more spiritual approach to it might feel, kind
Right.
of thing.
It's kind of all the same thing, isn't it? And I'm a spiritual person, like I fully believe in another side in the spiritual life. And the people who work with me who don't believe in that don't even know that I believe that. Like they're fully just connecting with the wisest parts of themselves. And I don't project that I think mom's right there.
Right.
That's all on them and like their belief in what they feel like is happening right then in that moment.
Yeah, which a little note for anybody who's never been to a therapist, like your therapist should never be like, I believe this, or like push their beliefs
Yeah.
on you. Like
Yeah. That's weird.
it's yeah, it's weird. Like I've had so many therapists who have been open to my spiritual experiences, or had questions about my spiritual practice, but like I've never felt like they are like, oh, well, I believe this. You know what I mean?
Right.
Like I've never had a therapist do that. And even though there's, been signs like maybe they'll wear a certain necklace or something like that that's
Mhm.
connected with their belief system, like it gives me a clue as to what they might be connected with or what they might believe. Yeah, your therapist should never be like, you should be doing this, and
Yeah.
have it be very spiritually motivated.
If they're
That's
arguing with your belief system, that's, like,
yeah.
not okay. That's not the
Red
right fit.
flag.
Yeah. I tell people from the beginning, because obviously there's, like, Christian counselors, right? And some people are
Yeah,
searching
yeah.
for Christian counselors, which totally makes
Right,
sense.
right.
Some people are searching for, like, polyamorous counselors because they want somebody
Yeah,
who understands their lived experience. When I do a consultation at the beginning of therapy, I tell people I happen to have a lot of understanding around astrology and tarot. If that's not in your belief system, we never have to talk about again. It's
right,
just like
right.
if Christian counselors can show up that way, I'm going to show up in telling you that I happen to know this stuff. And if you
Exactly.
if you know that stuff and you want to be able to use that language of like, oh, I'm a Libra moon, I'm going to know what that means. So we can
Right.
talk about it. So it's like the disclosure from the beginning, but not any kind of like push of we should talk
Yes.
about this. I just say it as a part of my like, this is a culture I understand.
Yeah, this is something that we can integrate into your experience if it's helpful for you or it makes you
Totally.
feel more comfortable. Yeah, and I
Hmm.
think I love that approach. That's what I always look for in therapists, and it always makes me so happy to see like more people being like that. After going through what we can use EMDR for mundane wise and spirituality wise, like what are some cautions that you would have for people kind of approaching EMDR, or whether or not, if they have hesitations or reservations, like what kind of questions could they be asking, or things
Yeah.
that they could be doing to help them get to a place where they know whether or not it's something that they want to try?
Yeah, I think definitely if you're going to see a therapist, ask them how they assess readiness because a part of the EMDR process is preparation, building a therapeutic alliance so that you can actually trust the person in front of you. There's some criteria. So, if you're in active crisis, meaning you're having suicidal ideation that's really chronic, it's happening every day, EMDR might not be good for you right now because it can obviously bring up some really intense emotions.
Right.
We want people to have a window of tolerance where it's like you can hit up right against the edge of discomfort of being like, I hate looking at this memory, but it's not bringing you to a place of like, you can't get out of that. We want people to have dual awareness where it's like, okay, I'm thinking of this memory, but I'm also here in Chris's office, right? It's like both things are happening. Some people, when there isn't the readiness of EMDR, which again isn't the person's fault. It's usually clinician error and like lack of training sometimes. People need to be able to access tough emotions without it being like, I'm going to go hurt myself after this because it was so
Right.
painful. Right. So if you have active self harm or suicidal ideation, we probably wouldn't want to put you into the trauma reprocessing. I would probably still do EMDR with that person. However, we would only be doing resourcing where it's pleasant, it feels good. We're connecting with emotions like joy and happiness. We're not connecting with that painful stuff because we need those images and feelings of joy to be there so that when we do eventually do trauma processing, I can be like, okay, bring up your joyful resource. So if somebody's starting to get out of their window of tolerance in trauma reprocessing, I'll be like, okay, bring up your river resource or bring up the Jesus resource. We're going to sit in that for a second. So that's how we try to keep that window. So self-harm, suicidal ideation, a lot of preparation and stabilization. If a clinician is jumping right into trauma reprocessing, that's a
Mm.
red flag to me. You have to have a lot of evaluation and preparation. There's a measurable scale called the DES2, and that measures dissociative experiences. So severe dissociation, dissociative disorders, it doesn't mean you're ruled out from doing EMDR. I would say if you have either of those, you want to find an EMDR therapist that specifically is trained and says, I work with DID. It can go very awry. If somebody is not ready, you can find yourself stuck in a part of yourself and not being able to get
Mm.
out. And so if the clinician doesn't have enough training to like support all of those different parts, it can be really re-traumatizing for people. It can be very harmful. So if you have DID or you have dissociative disorders, your due diligence, I think, is to make sure that you're very clear with the therapist of like, what training do you have to
Right.
support somebody with DID? And again, there's no like, you can't do EMDR. It would mostly be
Right.
stabilization, a lot of mindfulness, a lot of coping skills and tools before building that therapeutic alliance. And I think if I had somebody come into my office with DID, I'd probably wait like a year and a half, maybe, of just rapport building, stabilization, make sure that we're on the same page to build all of those tools to be able to do the trauma reprocessing. So that's another one. Unresolved medical or neurological conditions. So, because bilateral is like flipping the left and the right brain over and over
Mm.
again, obviously, if somebody has like a huge TBI, a traumatic brain injury, that impacts a part of the brain that we're tapping into, they're going to be affected, right? So, I usually would ask for them to get medical clearance from their neurologist or somebody that can say, okay, I can do this, or I need to avoid certain types of bilateral. People with seizure disorders is another one because obviously fast eye movements can trigger a
Yeah.
seizure. So you want to be careful with that. And it can be adapted. So if somebody has a seizure disorder, I might have them do tapping on their legs instead of any kind of like stimulus outside of themselves.
Right.
Active substance use is another one. Obviously, a lot of people, there's like socially appropriate substance use going on in
Sure.
our culture. It's like pretty normal. But if you're abusing really high risk drugs like heroin, fentanyl on a really regular basis, those drugs really numb really deeply parts of ourselves. It's going to be extraordinarily difficult to use EMDR effectively if you're high or numbed out. That said, there are some protocols for substance use disorders where people can be in active use. However, it's never recommended to be like high in your EMDR session. People see cannabis as like a pretty low grade drug. Even cannabis, you don't want to be high, even if you're a stoner and you use it every single day. It's still a numbing thing and it can like assist dissociation, and so you want to be able to
Right.
be in the present moment. Obviously you can still do EMDR during pregnancy, but we want to postpone any like big trauma stuff. We would focus on the gentler techniques, a lot of like butterfly tapping, which is tapping on your shoulders back and forth very slowly, calmly. Unprepared clients, or I don't love the word resistant because people have every reason to like be cautious around their
Sure.
therapy and stuff, but clients who are not ready to look at the traumatic memories, who are like, I don't even want to go there, they're not going to be well suited for EMDR because that tells me that their window of tolerance isn't there yet. They're not ready, and that's totally
Right.
okay. You'd want to build a bunch of rapport, educate about EMDR and how it works, and really look for readiness. The thing that comes up most in my practice is attachment wounds. I think a lot of people in our society have attachment
Yeah.
wounds, which sometimes, yeah, hello, both of us,
Me. Anxious
which is like,
attachment here.
yes, there's anxious attachments, there's avoidant attachments. There's also structures of personality that show up in the DSM 5 that would be called like borderline personality disorder, narcissistic
Mm-hmm.
personality disorder, antisocial personality disorder. All those things really do come from trauma. So everybody is worth like exploring their traumas. Not everybody's ready. But the trouble with like relational trauma and attachment is that there needs to be a lot of pacing and focusing on stabilization first. You also have to have good rapport because obviously the relationship between the therapist and the client is a
Right.
relationship, right? So there
Yeah.
needs to be a healthy attachment there and readiness to do that work. Usually, with people who have more complex attachments or relational trauma, I'm doing the IFS stuff first. So we're
Mm.
creating like an internal meeting room where all of the different parts of us feel comfortable meeting, and we'll use the bilateral, but really we're talking amongst the parts rather than going back to the trauma. Because let's say somebody's primary caregiver, let's say mom, was, let's say, a narcissist, right? So there was a lot of rejection of like, I'm not, I don't want to be around you. The person's going to develop this feeling of I'm never good enough. That's going to show up in EMDR where it's like, I don't think I'm doing this right. I don't think I'm doing the EMDR right. It's like, oh, does that feel familiar to childhood? Yes. Okay. Notice that, keep going. But we want to work with those wounded parts to make sure that they feel safe. And we want to work with the protector parts to make sure
Right.
that they're feeling like, okay, I'm ready to surrender and allow these wounded parts to do some of this work. We need permission from everyone to do that. The other interesting one where you might want to avoid it is if you're in a legal case where you have to testify, EMDR shifts your memory of the event to the positive, right? So you might no longer remember like the really harsh, scary details of it. It might just be like, it doesn't
Oh,
really, it just kind of floats to the background. So if you're going to testify in a case for yourself, it's recommended to just focus on the calming stuff instead of reprocessing the event that you're going to testify around because you won't be able to remember the details they're going to ask. The legal system
right.
is traumatizing. It's set up to harm people. I hate it. Victims have to go up and testify in front of their abuser. I think that's a disgusting model. And yet that's the model we have here in the US. So you want to proceed cautiously. I've talked to lawyers to just give them the rundown of like, hey, your client might not remember these specific details.
Right.
And to be honest, most lawyers have been like, that's okay. This person's in incredible pain. I'd rather them like get the therapy and be okay and maybe
Yeah.
forget some details. So if you want all of the nitty gritty of your memories and you are going to testify, you might want to hold off on the trauma reprocessing. So that's kind of the rundown of all the things you want to be cautious for. Sometimes when people are in late pregnancy, I might be a little bit more cautious, or any kind of like really vulnerable state. It happens a lot where people come to therapy and they're like, I'm going to this reunion in 3 weeks and my abuser is going to be there. And I'm like, oh no, I wish
Mm.
you came 6 months ago, because
Yeah.
that's like really quick to try to do that stuff. So we
Right.
probably wouldn't go into the trauma ahead of that. We would just do internal resourcing, bring in spirit guides, bring in the mountain figure of like strength, right? Whatever it might be to just like prepare for that event. But if you have an event coming up that you know is trauma related, give it like 6 months ahead of time to get into EMDR so that you can do some of that work. But yeah,
Yeah.
that's everybody who I might be cautious with.
That's so helpful to know because some of them, that would be something that I would make that assumption that that would be something to maybe hold off on until you've kind of built that internal library, if you will, of like
Oh, I
those
love that. Yeah.
resources and things like that. But there was a couple that you mentioned, especially like the legal case stuff. Like that's something that I didn't even think of, but that
Yeah.
makes so much sense of that you would want to be able to like access those memories if you needed it in terms of writing down the experience and documenting everything
Right.
and things like that before not erasing those memories but kind of
Mhm.
making them to where your brain doesn't hold as much importance on
Yes.
remembering the details of it.
A different perspective of the memory is what happens. And I know
Okay.
a lot of people who are still in their trauma aren't going to like to hear this, but I find a lot of the time people find compassion for their abusers and that's a part of their journey. That sounds really scary to somebody who's still in the trauma, and you do not have to have compassion for your abuser to recover. I'm not saying that. But I find that a lot of people in EMDR, let's say the parent was the abuser, they start being like, oh, they were abused and they were this little kid at some point and they were being harmed. And I have compassion for that younger version of them, even though they chose to repeat that harm, right? So
Right.
they might feel compassion for this abuser. And then often it's compassion for yourself. You have to be able to have compassion for this little kid inside that doesn't feel good enough. But if you're going to like testify and you're having a lot of compassion for the person who harmed you, that might be a little tough to be like, "Oh,
Yeah.
I forgot that they did this thing to me." So you just want to be aware that it changes the perspective of the memory. It doesn't like erase it.
Brains are so fascinating.
I know.
I love this kind of stuff. Like
Me too.
every time I talk to people about these things, like it just makes me feel like I should have been a sociologist.
You still can.
That's true.
There is
This is
time.
true. There's always time.
Yeah,
Um, well, thank you so much for
of
answering
course.
so many questions and like talking about this because I've been so fascinated with it. I haven't utilized it in my own therapy or anything, but I've heard of other people's experiences and seen it kind of, talked about on like spiritual TikTok and like spiritual
Mhm.
spaces online. And knowing that you did it, I was like, well, it looks like I'm gonna have a talk with Chris again.
Yes.
So it's just really, really fascinating. And it's just so cool to hear about the different ways that it can be utilized, even if it's not trauma based,
Yeah.
like it can be utilized in so many other ways that could be helpful for someone, like having those resources, that library, if you will,
Mhm.
for someone who has anxiety or something like that.
Right. You
So
never have
that's,
to do the trauma stuff, right? Like
yeah, yeah,
it's helpful, but if you just want the resourcing type EMDR therapy, you can do that. And you're the person that guides the therapy. So if you're like I'm not ready, the therapist might be like, "Okay, what's going on there? Do you just want resources?" and like explore what that might look like. You're in charge. You're the captain of the ship in any therapy, and so you get to decide what you want and don't want. So if you have anxiety and you're like, I don't want to look in the past, it doesn't matter to me anymore. Great. Let's do resourcing. Let's create a connection to your spirit guide so that when you call their name, you feel in your body that they're present with you. And it
yeah.
works like that. It can bring that presence.
Like we said at the beginning of this episode, if you want any more information about Chris, or if you are in the New Mexico area and you're looking for an
Yeah.
awesome therapist,
Yeah, if you're in New
um,
Mexico, I'm taking clients right now. I take some
hell yeah.
insurances. People can also find my LinkedIn. My name is Chris Lombardo. I'm in New Mexico. My business is Chiron's Cave Holistic Counseling. So you can find me on LinkedIn. I don't have any social media. Also, if anybody is curious about learning more about EMDR, I really recommend this
Yeah.
book. It's called Getting Past Your Past by Francine Shapiro. It was written by the person who discovered EMDR. She was walking in a park thinking about some traumatic stuff for herself, looking back and forth, and realized suddenly it didn't bother her anymore. So
Oh
she's
my
the
goodness.
captain of EMDR therapy. It's a fantastic book and it gives you some like self-help techniques if you're not feeling ready to see a therapist. I never want to recommend doing EMDR alone because it
Sure.
can open up some boxes you don't want to open alone. However, some of the stuff like butterfly tapping, if you just want to do
Yeah.
slow tapping on your shoulders, that's not going to harm you, right? Like that's just to comfort you. So, there's some great stuff in that book if people are curious to learn more. emdria.org, I want to say, the EMDR Institute. That's Francine Shapiro was the founder. That's who I got all my training through. They have lots of great resources on their website, including a list of EMDR therapists in all of the different states and countries if you do want to find somebody that matches for what
That's
you're looking for.
awesome. I love
Yeah,
that. Yeah. And I'll have all of that in the description as well. Thank you so much. Thank you so much for talking with us about this. And I hope it just brings up questions and like how it can be used in so many different ways. And I just really appreciate you taking time out of your day to
of
talk to us about
course.
it and help
Yeah.
educate.
Yeah, I'm always happy to talk about therapy stuff. I'm obviously really passionate about it. I think that it's such an honor and a privilege to get to witness people in like really hard periods of their life. I don't think that our jobs are all that different. You're just like working in the spiritual realm, helping people in a very similar way. And it is such an honor to be invited into somebody's life and these
Yes.
really intimate things that people who are closest to them in their life never get to hear. So I always hold being a therapist in the highest regard of like what an honor and a privilege. So
Yeah.
I'm always happy to talk about this stuff and hopefully inspire people to reach out if you're feeling ready for therapy. There's lots of wonderful therapists out there. Do lots of consultations and interviews of the people you're curious about, and then decide who you want to work with from there. But I recommend asking people about their training if you are going to do EMDR.
Keyword training. We want
Yes.
someone who's trained
Yes.
correctly in how to do
Yeah,
this.
very
Yeah.
yeah, very trained and like does continued education on it. If you're one of the people that were on the list of like where I might be a little more cautious, you need to ask your therapist, are you trained for working with
Right.
people with this thing? Because EMDR, there's a typical protocol and then there's lots of other ones. But if you have like a special condition that needs special consideration, you need to advocate for yourself and make sure
Yeah.
that you're being really clear about your needs there.
All right. Thank you so much, Chris.
Of
I hope
course.
you all have enjoyed this episode. And if you have any questions about EMDR or any questions that you would like Chris and I to discuss in future episodes, if you would
Mhm.
like to ask, we'll have it be Ask a Therapist.
I love that. There's a whole
Feel
Reddit thread called that too. Ask a
hell
therapist.
yeah.
Yeah.
Leave them in the comments below and I will totally have Chris back on for another episode so
Totally.
that
I'm
we
down.
can answer the questions that you all have. But I just appreciate you coming on and answering those questions. And
Yeah,
hopefully we'll be able to have you on the show again sometime soon.
absolutely. Always happy to.
All right. Thank you so much for listening. Bye, ghosties. I hope you have a wonderful one.